You're listening to the Monday Night Community Show with Daniel on BRFM.
This is the Daniel Monday Night Community Show on demand through YouTube. Thank you very much for choosing to listen to us through this method. If you'd like to keep up to date with when I add new interviews, then subscribe to this channel. I'm going to be talking live in the studio to Mandy and Marie. It's part of our regular slot with the Health Visitor Swale Team, Sheppey team. Firstly, as always, welcome along, Mandy. Thank you very much for coming back.
Well, thank you for inviting us back. It's really nice to be here, especially just before Christmas, and you've got all your nice decorations up.
Yes, it is looking very, very nice. I was wondering if you could give us a little bit of an introduction to start us off into what you do and your role as well.
Well, we're part of myself and Marie are part of the Sheppey Health Visiting Team. Marie is a community nursery nurse, and I'm a health visitor. And we work together in a bigger team based in Sittingbourne, although we obviously cover Sheppey. And we offer help and guidance and advice to mums and families of children under 5. So we take over where the midwife leaves off when they've been discharged from hospital, and we continue to visit families until they're ready to go to school, till the children are ready to go to school. And we offer developmental assessments, we offer advice on feeding, we offer advice on sleeping, behaviour problems, anything to do with your under 5 we can usually help, or one of us in the team can usually help you.
Now, I know you wanted to talk a little bit about preparing for Christmas.
Yes, I was thinking about the theme for today and thinking, well, what is topical? It needs to be something that's relevant to now and something that we're all thinking about. And most people at the moment are thinking about Christmas. And, you know, some people will be thinking about Christmas in a very positive way and really looking forward to it, very excited, getting involved in decorating their houses and buying presents and all of that. But for some people, Christmas can be a very difficult time, as we all know. But also it can be quite an unsafe time as well. It can be quite a dangerous time. So it's something that we want to not to spread doom and gloom and give people a miserable lead into Christmas or introduction to Christmas, but from a health point of view, we'd like to just point out some of the things for families to look out for over the Christmas period so they can have a really safe and happy Christmas.
Preparing for Christmas.
Yes, I mean, we're talking about a healthy Christmas and a happy Christmas and a safe Christmas. Unfortunately, we do have some statistics that might shock people, but it is that Christmas can be a very dangerous time, and it's usually a dangerous time in terms of people having accidents on the road, traffic accidents, accidental poisoning, accidental falls, accidents caused by fire, accidents due to environmental factors such as flooding, which of course has been topical in the last week or so. Suicide, sadly, is usually raised for men and for women in over the Christmas period, and again, sadly, homicides or murders and assaults increase as well during the Christmas period. A lot of that is fueled by drink and drugs, of which there are problems with drink and drugs in any community. But there are trigger points and there's sort of flash points over Christmas where drug use and alcohol use can be increased, and that can actually cause a lot more accidents and a lot more deaths, unfortunately. So what we've actually going to be looking at is the most obvious, I think, is alcohol. One of the problems of the celebrations is that people will drink more. In fact, according to the NHS statistics, a 41% increase in alcohol consumption in December, which is the highest in the whole year, the highest month of the monthly averages over the year. So it's a great big sort of boost of good for the alcohol sales, but not good for our health. And that's something that we really need to be aware of, because excessive alcohol obviously causes a lot of problems with people's health, liver disease, heart disease, strokes, all sorts of physical problems, but also can cause a lot of psychological problems as well, and can cause people to have a lapse of judgment and to not be safe perhaps to look after their children, to take risks that they wouldn't normally take, be uninhibited, and that can be something that can completely destroy somebody's Christmas.
And we're talking all about preparing for Christmas at the moment.
Yes, we just go back to a little bit about the alcohol that we were talking about just before the track, and I think some of us don't realise just how much we do drink, and I think some of the glasses and the units get a bit confused. And there are desktop alcohol trackers, and they are on iPhone apps as well that you can actually download so that you can see exactly how much you are drinking. We all know that 2 to 3 units a day for a woman is safe, and 3 to 4 for a man is safe. But that doesn't mean to say that it's every that is what you should drink every day. It's the maximum that is a safe limit. But for example, if you go out and have a glass of wine, which is a large glass of wine, you're actually drinking 3 units. So you're not having 1 glass of wine and 1 unit. You're having 3 units in that glass. So you need to be very, very, very careful about what you're drinking. Now, coming on to children and the under 5s and newly and pregnant mums or newly delivered mums who may be breastfeeding, then obviously, as health visitors, as health professionals, we wouldn't advise that you drink anything while you're doing that, while you're pregnant or while you're breastfeeding. There are limits that are safe to be considered when you are doing that or you are pregnant. But I personally, as a health professional, would not advise anybody to drink while they're breastfeeding or while they're pregnant. You can look onto NHS Choices, which is the website for all the evidence, what we call evidence-based, or the information that we give out, and that will tell you about safe amounts of alcohol you can drink, or what to do when you are breastfeeding, for example, not to drink for 2 hours, not to breastfeed for 2 hours after you've actually had a drink. But we would obviously advise to be very careful and make sure that you know what is safe and what is not. And if in doubt, look on the website, or you can actually ask us or ask your midwives, and they will give you the guidelines as well. So be careful and enjoy that side of Christmas, but be mindful also that there are other problems that can be caused with your Christmas. And I'll just give you a few little figures here. Every year, about 1,000 people are injured by their Christmas tree, and you wouldn't think that something as innocent and pretty as a Christmas tree would actually cause you injury, but it's usually fixing the stars, lights, or other decorations onto the higher branches. So you're climbing up, and you may have lots of people around you, lots of things around you, and around 350 people a year are hurt by Christmas tree lights. And the injuries include people falling, obviously, children swallowing the bulbs, and people getting electric shocks and burns from faulty lights. So to be very, very careful when where that's concerned, and make sure that you take your time and be safe.
And we're continuing to talk all about preparing for Christmas.
Yes, I mean, I've just told you some of the figures about Christmas trees, and unfortunately, with the Christmas trees, there is the danger that it might catch fire, and that there are the statistics that you're up to 50% more likely to die in a house fire over Christmas than any other time of the year, which is a massive figure, really, to think about dying in a house fire at Christmas, which would be absolutely tragic. And a lot of that is around faulty lights on Christmas trees, and it's around overloading sockets and that kind of thing. And it's also lots of people burn candles, and they are very dangerous as well, especially when they're left unattended. So you've got, you need to be looking out for children around Christmas trees. You've got to be looking out for sockets and wires, trailing wires, and faulty things, so that they don't get injured or they swallow the lights. And I've got Marie, who's going to just mention a little bit about where you can get safety equipment if you need to, and continue that theme, really, of looking after your children over Christmas.
Yeah, on the island, there is a few children's centre. We have got Beaches Children's Centre, which is in Warden Bay, Ladybird Children's Centre, which is in Coimbra, and Seychelles in Sheerness. And they offer equipment for safety, like socket cover, gates, and also they do run some activities of how to minimize dangers and accidents with young, small children. So you can be able to get some more information from those children's centres.
Thank you for that. Moving on to other things, other hazards at Christmas. And the next thing, of course, is food poisoning. Food poisoning is very common over Christmas, and most of that is because people wash their turkeys. People wash their turkeys, and it's not advised that you wash your turkey, that take it out of its packet and put it straight in the oven, because if you do wash it, the germs go all over the surfaces of your kitchen, and you put other things down, or you have it all over your hands, and then you can actually transmit food poisoning by doing that. So be very careful when you're cooking your turkey, and make sure that you cook it all the way through so that you don't end up with food poisoning. And leftovers as well, when you put them in the fridge after you've finished your turkey or whatever it is you're eating, and don't keep anything longer in the fridge longer than a couple of days, 2 days actually, because you could be at risk of food poisoning. So that is something that can be very serious, especially in the young, especially in children, obviously old people as well, but especially in the very young children. It can be very dangerous.
We're talking all about preparing for Christmas at the moment.
Yes, and I expect everything sounds a little bit negative and a bit doom and gloom, but obviously, you know, Christmas is a fantastic time, and it's especially for children. It's very exciting, but we do need to be careful that we have a safe Christmas. So really continuing on from what we were talking about before with the fire risk, which was those figures were pretty horrendous, really. It's important to remember that also our fire service can help out with advice on fire alarms and fire and keeping your home safe, preventing fires. So that is always there as well, and I believe that they do talk about that when they come on.
Yeah, they do.
So moving on really to something again that is probably something that some people will be sitting at home worried and concerned about, and that is the increase in domestic abuse that happens over the Christmas period, which is something that you may be sitting there now thinking, what's going to happen over Christmas? He drinks too much, or she drinks too much, and it all kicks off, and you know, there is a danger there of injury, even a danger of murder, and the risks are very high. So it's minimising those risks. It's having your plan of action. If you are in an abusive relationship, it's having your plan of action. What are you going to do if things do get difficult? Are you going to be able to leave the house? Are you prepared with the children? Do you have somebody to call, somebody that you can actually call on to be with you or to go to be safe? And obviously there are the national helplines, and there is local advice, and I'll give out the 24 emergency helpline number for the National Domestic Violence Centre, and it's 0844 8044 999. And there is a text. You text NCDV to 60777, and that's something where you can get confidential advice if you are in difficulty. Obviously, if there is an immediate risk, and especially an immediate risk to the children, then dial 999 for the police. If it's a non-emergency, then it's the 101 number for the police as well for advice. So keep the alcohol down as much as possible. Have your plan of action. Get help as soon as possible, and make sure you and your children are safe.
And we're talking all about preparing for Christmas at the moment.
Yes, I think we've talked about different things that people can look out for and be careful so that they do have a happy and a safe Christmas. And I suppose we can just round off really by bringing everything together and remind ourselves of some of the things that we all need to look out for, especially those of us that have got or those of you that have got small children at home, and to make sure that we do stay safe. So we've got the fires. We talked about the fires and the falls and the faulty lights and the exploding Christmas trees and the extra sockets and the wires and things like that. Keep safe with those. Make sure everything's working properly. Make sure when you are standing on a chair, that it's safe to do so, and that you're not on your own, that somebody's there with you. Ask advice, get equipment if you need it, go to the children's centres, talk to the fire service if you've got any doubts. Cutting down on your drinking. Obviously everybody wants to have a good time. Be careful with the drinking, especially in charge of young children, and obviously don't drink if you're driving, and be very careful then the morning after as well. If you've been drinking, you can still be over the limit the next day. keeping calm at Christmas. Don't let the stress really boil over. Don't get too stressed. Don't try and have unreal expectations of what Christmas is all about. It's about being together as families. Some people are struggling at that time. Some people are very lonely. Some people are in relationships that are not very healthy. And in that case, do ask for help. And we've just given you that number for the helpline. Keep warm. Don't keep too warm. Make sure that babies are not kept too warm. That they are not in bed with you, especially if you've been drinking. That they are sleeping safely in their cots. That they are not exposed to smoke or any dangers in the home. Make sure that you keep well, that you don't. You be careful with your turkeys and your food, your party food, Christmas food that you leave lying around maybe, and be careful that if you're entitled, if you want to go and have your flu jab, go and have a flu jab. And now children, I think we mentioned last time, little children are being given flu vaccinations between the ages of 2 and 3, and they're given them by nasal spray. So the GPs should be mentioning those so that they can be kept healthy. Obviously, check with your neighbours and older relatives if they're on their own, or if there are any problems in terms of cold weather. If we get any very bad cold weather, things like managing your child's asthma. If a child has a condition like asthma, how do you manage that in the cold? And make sure that they have all the medication they need, and medication. They make sure that you do have all your medication you need over the Christmas period, especially if there are it's more difficult to get hold of things. Keep your first aid kit well stocked. Have some things just to hand if you need to over the Christmas period, and take some time. Take the time to plan your Christmas properly and to be safe, and have a very, very happy Christmas. And I'll finally finish off by saying that it's been really good to come and share all this, and that we don't want to spread doom and gloom, but we do want to make sure everybody has a safe Christmas. Our telephone number for the health visitors is 01795 433 950, and on a Monday, Tuesday and Thursday we stay open until 8 o'clock in the evening. So most of our hours are 9 to 5 Monday to Friday, but on 3 evenings a week we are there on a helpline to answer your questions between up to 8 o'clock in the evening, Monday, Tuesday and Thursday. Happy Christmas.
Well, yeah, very Merry Christmas to the both of you. Thank you very much for coming along, and I know you're going to be coming back in January, so we look forward to seeing you then.
Yeah. Thank you.
That is Mandy and Marie right here at BRFM 95.6 as part of the regular slot I do here at the Monday Night Community Show with the Health Visitor Team Swale and Sheppey right here at the Monday Night Community Show this evening.